introduce my audience, Matt and Olivia, Crystal, my mother, and Tommy. In one day, each person has many thoughts, but there's one thing that we just don't need to think about, and that's breathing. You can think that to our autonomic nervous system in the back of our brain. It constantly reminds our body to take a breath in and exhale out. Per my nursing experience and also Discovery Health, you take a breath for 12 to 20 times in a minute. That's 11,000 liters in a day of air that you bring into your lungs and you exhale out. What I'm going to talk to you about today is the anatomy of the respiratory system, what were to happen if you were to get a puncture in your chest cavity, and how medically we fix that. So starting with the anatomy of the lungs, with my visual aid, I have here the trachea, which is the straw, and you can also visualize that as a trunk of a tree. You have your bronchi, which spear out to the left and to the right, which you can start thinking of that almost similar to the roots that are starting to go into the ground. Then when you get into the lungs, to the left and the right, on the inside, there's things called bronchioles. And those are smaller roots, just like a tree, that go into the soil. At the end of the bronchioles, there's things called alveoli. Now the alveoli are grape-like sacs that at the end, there are capillaries. So in the capillaries is where gas exchange happens. And that's when oxygen and carbon dioxide, as you're inhaling in the oxygen, start to exchange with the carbon dioxide that are in the blood vessels. So you're able to take that big deep breath in and exhale that carbon dioxide out. So what this outer portion is actually your ribs. That's going to be your chest cavity. And on the inner portions are obviously the left and the right lung. So one portion that I didn't mention yet is the diaphragm. So the diaphragm is very important as well. When you're inhaling in, your diaphragm expands, and that's what actually helps your lungs take that big deep breath. So when you're exhaling, the diaphragm actually crunches together to help you exhale all of that carbon dioxide out. So with this visual aid here, the bottom portion here is actually your diaphragm, and then you have your left and your right lung. So as you're taking a deep breath in, the diaphragm is going to get bigger, your lungs expand, and then when you're trying to exhale, the diaphragm goes up and it contracts, and your lungs then go back to normal size. So when I talked about you having a medical emergency where something might have punctured your chest cavity, or you have some sort of genetic disease like COPD, or you have pneumonia, your lung can then collapse. So same kind of concept, you have your lung and then you have your diaphragm. There's actually a big hole on the side here to show if something were to puncture your chest cavity. So as the diaphragm is expanding, your lung is no longer expanding, and you're not able to get that oxygen into your lungs. So this can actually happen to both lungs if there's trauma to both sides, or it can happen to one or the other. So when the diaphragm goes down, the lung doesn't expand, you're not able to get that oxygen into your lungs and be able to pass that through your cells, through the rest of your body, through your circulation. So then you have a buildup of carbon dioxide, which obviously isn't good. So what we like to do is have a chest tube, and it's a plastic, circular, just like this, almost, just a little bit bigger, similar to a straw, that goes right into that hole where we have on that chest cavity, and it's just sewn onto the side, just like stitching. And what this does, this gives you that nice vacuum inside that chest cavity of what you need to make sure that your lungs can expand to bring in that oxygen and exhale to bring out that carbon dioxide. Normally the chest tube just stays in for 2 to 3 days, and then it gets removed once they can test that your lungs are fully expanding. So as you can see still, I mean, obviously with this, you're not going to be able to see the full length of the lung expanding. But so eventually, what you would be able to do is get your lungs to fully expand and then go back to normal with that chest tube working. So next time that you're breathing, make sure that you thank your autonomic nervous system for giving you the chance to live today. Thank you.